This is Radio Health Journal. I'm Reed Pence. This week, are pigs the answer to fixing the organ shortage crisis?
Kidney transplant is, in fact, a cure for end-stage kidney disease, and that currently the supply of human organs just cannot meet that need.
How doctors are closing the gap between supply and demand when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
New York Harbor, people have started in recent years to see whales that haven't been seen in that area close to the city, in some cases a century or more.
The resurgence of wildlife in urban landscapes. Then,
the only people who don't have regrets are 5-year-olds, people with brain damage, and sociopaths. The rest of us have regrets.
Understanding the gut-wrenching feeling of regret. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
There are more than 100,000 people in the U.S. currently on the National Transplant Waiting List, but the United Network for Organ Sharing reports only 41,000 transplants happened in 2021. And though that set a record for most life-saving transplants in a year, it still left thousands without a healthy organ. According to the Health Resources and Services Administration, 17 people die every day waiting for a transplant. For people living with kidney failure, a transplant is a cure. But what good is that if the sick can't live long enough to get a healthy organ?
Kidney transplant is, in fact, a cure for end-stage kidney disease, and that currently the supply of human organs just cannot meet that need.
That's abdominal transplant surgeon Dr. Jamie Locke. She's also director of the Comprehensive Transplant Institute at UAB, the University of Alabama at Birmingham, where she helps research the future of kidney organ transplants. Nearly 800,000 Americans are living with kidney failure, with a higher number of cases in the South. Alabama leads the nation, reporting twice the national average, according to the Alabama Department of Public Health.
And it's important to note that we suffer from a very high degree of end-stage kidney disease burden here in the Southeast, and particularly in the state of Alabama. And we also see health disparities related to this, such that our African American patients are disproportionately impacted by kidney disease, kidney failure.
To help solve the organ supply crisis, Locke sees big potential in using animal organs for humans who need transplants, specifically pig organs. She's been working on the idea since 2016, when she helped develop the xenotransplantation program at UAB. Frustrated by the growing gap between organ supply and demand, Locke's research focuses on making pig kidneys a viable option for organ transplants. She's seen how a kidney transplant changes people's lives and wants to make that option possible for everyone who needs it.
I always loved science, but I wanted to be able to make a difference. During training, transplant was just the ultimate team sport. I really enjoyed how much we were able to interact, not just with our fellow surgeons, but with our medical colleagues, our social work colleagues, the pharmacists. I mean, it really takes a whole team to take care of these patients. And when you're in the operating room and you're doing this transplant for someone who's in end-stage organ disease, and you know how much they've suffered, and you put in that new organ and you watch it begin to work. In the context of a kidney transplant, you watch it turn beautiful and pink, and it makes urine before your very eyes right there. And you know in that moment that you've cured the patient.
Locke is the lead surgeon on a recent study published in the American Journal of Transplantation, where she was finally able to try out pig kidneys in humans. Using animal organs in human transplants is not a new idea. A doctor in the 1960s transplanted chimpanzee kidneys into humans 13 times. All were unsuccessful, and the human patients died. But Locke used genetically modified pigs to make the kidneys more compatible with humans and reduce the chance of immune rejection. The pigs are kept in a pathogen-free facility to keep them from getting diseases that could be passed on to humans. Initial transplants were done in baboons through a partnership with Revivicor, the company that provided the altered pigs. Locke says the test showed these kidneys sustained the baboons very well and for many months.
But there were really key safety questions that we just couldn't answer in a non-human primate model. So while non-human primates are similar to humans, they're not exactly the same. They're actually immunologically quite different. And so while we had not observed hyperacute rejection with the 10-gene edited pig in a baboon non-human primate model, we had no way of knowing if that was going to be the case in a living person, because the immunosuppression regimen that you use in a non-human primate model is actually quite different than what we use in human-to-human allotransplantation. And so we wanted to be able to test that, but we really felt that this was something we needed to be able to test prior to moving into a living person. And the reason for that, and it makes sense, is that what we call hyperacute rejection, meaning the moment you sew in the kidney transplant and you restore blood flow, it turns black and is immediately rejected and has to be removed. That's considered essentially a never event now in modern human-to-human transplantation.
And that's because of something called a cross-match, a test to figure out if the donor and recipient's tissues are compatible before performing surgery. This test is a federal requirement and helps prevent hyperacute rejection. The problem was that a cross-match for pig-to-human transplants didn't exist.
So one of the things that we did was develop a test to be able to do that, but we had no way of confirming the validity of our test without actually doing the transplant. And so about 2 years ago, we began to explore the concept of could we use human brain death as a novel preclinical model, our preclinical human model. And we began actually by getting an external ethics review to really look at this, as well as we engaged our institutional review board, which of course is responsible for human subjects research. It's important to note that brain death is death, so by definition a brain dead human, that does not meet the definition of human subjects research currently. But we felt that it was really important that they be involved because we wanted to be able to recapitulate as close as possible what we would do in the context of a xenotransplant in a living person.
So Locke found a man who had been pronounced brain dead after an accident, 57-year-old Jim Parsons. Parsons was a registered organ donor, but unfortunately his organs couldn't be used in transplantation. Instead, his family agreed to donate his body to Locke's theory, finally allowing her to truly test all the working parts of her study.
So with all of those things in place, we embarked on this study, and we designed the study to do a couple of things. One, to test our operations, our pathogen-free facility, making sure that the operating suite we had out there for the recovery of the pig kidneys functioned every way it was supposed to, that we could package and transport them, so that essentially we recapitulate to the T human-to-human kidney transplantation, with the only difference being the source of the organ coming from a pig instead of a human. We also performed, using our novel assay, this cross-match, and we predicted prior to transplant that the pig kidney was a good match for Mr. Parsons. But the only way to validate that was to actually do the transplant. And so when we did that, and the kidney turned beautiful and pink, and it stayed pink, and it actually began to make urine, we were able to demonstrate definitively that there was no hyperacute rejection, and importantly, able to establish this assay as both novel and a valid way to test tissue compatibility.
The team kept watch over Parsons for 74 hours after surgery.
And then the reason we continued it out past that initial time point is that we wanted to collect other key safety pieces of information. We wanted to be able to surveil Mr. Parsons' blood for the presence of porcine endogenous retroviruses. We wanted to know, was there any disease transmission, and we were able to demonstrate that there was not, which is another key safety element before moving into a living person. We also wanted to make sure that we did not see circulating pig cells in Mr. Parsons' blood, because that would indicate chimerism and could be indicative of future graft versus host disease, which we also would not want to subject a living person to. So that was the reason to carry it out for 3 days. And so we feel that we collected all of those critical data elements and have really leveraged this brain death model to the extent that it is going to help us move things forward And really the remaining questions we have are only going to be answerable in the context of doing this in a living person.
Which is why Locke's study had followed the steps of a typical Phase 1 clinical trial as closely as possible. This strategy gives regulators like the FDA data that follows protocols required in the next step, which is a clinical trial.
We think we're ready. We think we have enough data to suggest that it's time to move this into living persons.
A step that's already been taken with a heart transplant. Recently, a team in Maryland successfully transplanted a pig heart into a living 57-year-old man using the same types of genetically modified pigs from Revivicor. Though this was not a clinical trial, the FDA gave emergency use authorization for the procedure. Locke is hopeful the successful kidneys and weeks-long survival of the heart recipient will help speed-track the progress of xenotransplant research.
So I think that bodes very well in terms of having the FDA be engaged around the approval of kidneys to go into living persons as well. I think everything that others are doing is critically important, and it's really important that it be reported in the scientific literature so that we can all learn from this, because it's really going to be that collective expertise that's going to drive the field forward and help us get to our ultimate goal, which is to help our patients. I think we have to remember our ultimate enemy is kidney failure, and so the only way to defeat that enemy is to collaborate, come together, make sure we're reporting our results in peer-reviewed format so that we can really move the field forward.
Progress that would mean finally closing the gap between supply and demand, bringing an end to the organ supply crisis.
Well, I hope the future is that we no longer have a waiting list. I mean, I would love to have an organ available when someone needs it, and that's really, I think, our ultimate goal. But certainly we feel very strongly that as we progress through this, that xenotransplantation really affords us the opportunity to fill the gap that human allotransplantation has not been able to fill.
And for those wondering about the ethics of genetically modifying and breeding animals just for their organs, Locke says ethics are always at the forefront of her research.
I think about the ethics of everything I do every day, whether it be my interactions with humans or whether it be my interactions with animals that may be used in research in whatever capacity. And what I can say is that I think, again, this is why I think these types of things need to be done under the umbrella of various regulators. So in the context of human subjects research, it's why institutions have institutional review boards to ensure that human subjects' rights are protected. Similarly, institutions have institutional animal care and use committees, which is the animal version of an IRB for the exact same reason. And everything we do here at UAB is under the umbrellas of those two regulatory bodies, and everything we do is fully transparent. And we make every effort at the conclusion of our studies to be sure they're reported in the scientific literature so that others can review this and we can hold each other accountable to the appropriate standards.
This study is groundbreaking for the future of xenotransplant research, something that Locke reminds us would not have been remotely possible without Jim Parsons and his family. A future where everyone who needs a healthy organ can get one is a whole lot closer because of them.
I really want to take the opportunity to thank the Parsons family. I think what this family did is truly extraordinary, honoring their loved one's decision to be an organ donor, both for the purposes of transplantation but also research. And their willingness to let Mr. Parsons participate in this has, without a doubt, moved medicine forward. I think there is much more to come about how the Parsons model, a preclinical human model, can be leveraged to study diseases and other things that extend far beyond xenotransplantation. And so just a huge thank you to them.
You can find more information about Dr. Jamie Locke on our website, radiohealthjournal.org. For more behind the scenes, search Radio Health Journal on Facebook and Instagram. Our writer-producer this week is Kristen Farah. I'm Reed Pence. Coming up next week on Radio Health Journal.
I think this pattern of using these apps can get you kind of a little obsessional circle.
How diet apps could be hurting your health.
Then grown-up goldfish are taking over ponds and lakes.
There may have been these invasions going on under our nose and we just never even knew or just couldn't believe that that's what it was.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.